Hey everyone. So a couple of weeks ago, I had a really cool opportunity to go to Washington, D.C. with the American Gastroenterological Association, or the AGA, where they had their Advocacy Day on the Hill. And this is something that's really cool where they set up meetings with your congressional representatives, so members of Congress. That would be the House of Republicans and the Senate. And you meet with their staff, and sometimes you meet with the representative to talk about certain legislative bills or policies that we've identified, or the AGA has identified, that will benefit patients. And so I went and was with several other patients, and we went and met with these representatives on the Hill to talk about these very important bills and legislation that we hope to see pass, and that we hope that our representatives will support, so that they get passed through the Senate and the House and become law. This is a really, really cool advocacy opportunity and experience, and an avenue of advocacy that a lot of people don't necessarily always know about, or know how to get to it, or what to do. So I wanted to talk a little bit about my experience and how I got involved in sort of the legislative policy advocacy side of things, because those are the that's the type of advocacy that can have a ginormous impact. So not just for people like me, or that has Crohn's disease, or people living with, it affects people living with other diseases. Like, I have a rare disease called hypophosphatasia as well. These bills and legislation would help that disease as well. So it not just is there with the AGA, but we're talking about, again, legislation that would affect hundreds of thousands of patients here in the United States who don't just live with a GI condition. So we talked about, there were two specific like policy or bills that we were talking about that we wanted our representatives to support. There was one that was step therapy reform. So if you're not familiar with what step therapy is, if you're a chronic illness patient, you probably are. But step therapy is where your insurance company wants you to try a certain drug first before they approve another drug. So, for instance, your doctor may think that you need to be on some sort of IV infusion or injection, and so they prescribe it. However, the policy with your insurance is that you need to take a pill first, or sometimes it's you need to take a different injection first before they will approve the other medication. Sometimes you'll hear it as like a fail first policy, but it can genuinely be harmful for patients and stressful, and puts a lot of burden on the patient, on the provider, and just can put patients in a tough position, because it's not necessarily the medicine that the physician wants you on. But there are these policies in place with these companies where you really don't have much of a choice but to do it. And then if you fail it, then they'll approve the other medication. So step therapy is can be very harmful for patients. It can have a huge impact, a negative impact. So we talked about a bill that would reform that and make it not necessarily non-existent, but to put some common sense guidelines in place for step therapy, to where that there's appeal options. So to where if your provider wants you on a specific drug, and there's a step therapy policy in place, there's a clear, defined way to make the provider to make their case for you in a very quick and efficient way, that the reason why you need to be on this other drug, and not go through like a pill first. There was another one that we talked about for prior authorization reform. So prior authorization, again, if you're chronically ill, may not even if you're chronically ill, you potentially dealt with prior authorization in some form, whether that is prior authorization for a procedure like surgery, MRI, CT scan, or prior authorization for a drug. So there are multiple, things that need to be prior authorized. So this was also in just to advocate for better guardrails around prior authorization for chronic illness patients, and to make a fast, streamlined, efficient way to get the prior authorization, to appeal it, and to have a direct line of contact with the insurance company to make sure that patients aren't suffering. For example, I was actually meeting with with a GI doctor who was with, he and I were the two representatives for my state, Mississippi, and he was from. By the time that they ended up getting the response from the actual insurance, they told him, I think, like 5 days. On the fifth day, he didn't hear anything. And they're like, oh, basically, we forgot. And then it added another 2 days. And this person had traveled from out of town for this, for like the scope. And then they needed a PET scan. And it was just really stressful. And there was no direct line to somebody at the insurance to get this fast tracked. So there are so many stories like that to where it has just genuinely harmed patients and patient care. And so we're just trying to talk about having laws in place that protect patients, that it doesn't necessarily mean get rid of prior authorization or get rid of step therapy, but the processes that are currently in place just are not working and they're harmful to patients, and that's just the truth. So we were able to sit with our representatives and their staff and talk to them about these bills and this legislation that we hope that they will support, and if they've already supported it, to continue to support. And this is huge because that not only are we're speaking with our representatives that, like, we live in the, for instance, live in the district of or the state of, and letting them know that as their constituent, this is what we want. So this type of advocacy is super important, and it affects so many patients and can have this huge impact that, and to me, is like really, really cool because you're taking the time to really advocate for these bills, and that can end up being law that can change the landscape in a huge way for patients. So how did I get involved in all of this? I get that question a lot, is how do you get involved in legislative advocacy, and how do you get, to meet with these representatives and stuff? And I will say part of it is just being a vocal advocate, just on the internet in the space that I'm in, and talking about these important things. But some of the tips that I can say is start getting involved on the local level first. So figure out who your representatives are, like locally. So like maybe the city that you live in, who's your city representative, who's your state senator and your state congressperson. Figure out who those people are. You can go, honestly, quick Google search. I mean, truthfully, you can just go in and search for who is my local congressperson and city, state that I live in, and it should bring it up. And then what you can do from there is these people can be reached. You can reach their staff, their office staff. Obviously, they are your representative, so they want to hear from you, and at least they should want to hear from you. And so they have ways to contact them. So start off that way is my advice. So figure out who at your local level, who can you talk to, what representatives, and then two, you can see what bills that they are supporting. You can also check what type of health policy bills are going on in your state and what committees they have to go through and who is on those committees. So a lot of it is just kind of doing a little bit of research on your own, but there's some really good websites and tools out there for you. Again, some of the, for instance, in like the inflammatory bowel disease space, some of these, the foundation that we work with, or like the AGA, like they typically have these policy sections that you can go to online and just figure out what are some of the high hitting policies that are out there. But getting involved at the state level first is a super easy way to start your legislative advocacy journey. And then from there, once you kind of get your feet wet in that, you can start potentially looking into more of these federal types of legislative advocacy, like Day on the Hill. So typically a lot of foundations out there, like chronic illness foundations, have days on the Hill. So like the AGA does, the Crohn's Colitis Foundation does. There is, so I'm on a legislative task force for the National Organization of Rare Diseases, and they do a ton of policy work at the federal level and the state level. So getting involved with foundations is one of the easiest ways to start that and to get involved at that higher level, to go to Congress in Washington, D.C. and and get these meetings with these representatives, it does take a little work on your end to start figuring out who your representatives are, what policies are they supporting or not supporting, what policies out there are just kind of like in the chamber or upcoming that are important to you and that you want your representatives to support, to sponsor, so that that passes and becomes law. So once you do all of that and start getting involved, at that point, it really just it does become a little easier to kind of transition into continuing the work with the higher federal level. So that's my advice. Start local and then kind of expand and broaden and just share your story with these representatives. You can even reach out to your representative, your local representative, email them. You can share your story. You can share a little bit of your story and what you've gone through, and then eventually you can actually set meetings up with your state representatives as well. So oftentimes our staff will meet with you. And it's just a really cool thing to be able to meet and talk about these policies. And it's it's one of those where it doesn't necessarily matter what side of the political spectrum that some of these representatives may fall on, because they are your representatives whether or not you voted for them. I mean, they are, and they have the ability to co-sponsor bills and help get things passed. So you just share your story with them, and as a constituent, they should listen and take into consideration what you're saying. So again, legislative policy advocacy is such a cool way to get involved in the advocacy world, and I know that there's so many people who want to do it and they just don't know where to start. So that is my advice, and I said that previously, but get involved locally, get involved with nonprofit foundations. Again, a lot of these nonprofit foundations have a policy section or like division of the nonprofit, because they know that these policies and laws are really what can have a huge impact on patients and kind of change the landscape for patients in huge ways. So get involved with the foundations, get involved locally, and start reaching out to your representatives. You may be surprised that some of them are like, yeah, let's meet. Let's come meet my staff, come meet me, especially if it's your state representative. And then just share your story, what you're trying to accomplish, and just do a little bit of your own kind of internet research on the bills and the policies that are health related, that you think are important to you. So that's my advice, my spiel. Legislative policy stuff is really cool. Again, I've worked with several foundations. I've worked with NORD, the National Organization for Rare Diseases. We're trying to pass a rare disease advisory committee in Mississippi, where I live, and I'm part of that kind of push. And that is a local or state thing, not federal. That would be a Mississippi RDAC, as they call it. Just a little bit about that. We haven't been successful yet. It's not come out of the committees, and we've made a huge push, but we're working on it. I have done what I've told you all is I've reached out to my local representatives. I have reached out to the people who are on the committee and who are sponsoring the bill. And then I've I've helped bring in some foundational support from, nonprofits, hospital systems, physicians who have signed on to have these legislators support. And then I've just been in very close contact with the nonprofit foundation, their policy team, and then my local people. So hopefully in the next year or two, we will get an RDAC, RDAC, or Rare Disease Advisory Council started in Mississippi, because we need one. Rare disease patients in Mississippi, like rare disease patients in a lot of places, need support, and an RDAC would provide a lot of support for patients like myself. So let me know if you have any questions about policy advocacy, how to get involved, any additional resources that I can help you with. Please reach out, let me know. I have some connections, but I also can try to help point you in the right direction. So let me know if you need any help, and good luck out there advocating for these policy changes, because in the end, this type of stuff, the step therapy, prior authorizations, these things that truly impact patients, If we can get policies implemented at the federal level, they will have a huge impact on people like myself.